Hello guys, today we are going to talk about the bacteria that killed more than 400,000 people every year. The bacterium is called Acinetobacter baumannii. It can be found everywhere from soil to water to animals. However, it doesn't cause disease in healthy individuals. But for those who have weak immune systems or had recent surgeries or injuries, this microorganism can become very dangerous. In this video, I will reveal 20 scary facts about Acinetobacter infections that you probably didn't know before. So make sure to watch until the end. Also, please like and subscribe for future updates. Let's start. Number 1. Acinetobacter is a genus of bacteria with at least 37 recognized species. Of these species, only A. baumannii has been associated with nosocomial infections, and it is the most common cause of hospital-acquired pneumonia and bloodstream infections worldwide. Number 2. It is also known as the Iraqibacter because it was first isolated from water in Iraq in 1968, and it became infamous during the Iraq War when US soldiers started coming down with severe wound infections caused by it. Number 3. It is a gram-negative coccobacillus bacterium. This means that when exposed to gram staining during laboratory procedures, it will appear pink. It is also a facultative anaerobe, meaning that it can grow in the presence or absence of oxygen. It prefers an aerobic environment, but under certain conditions it can switch to anaerobic respiration or fermentation. Number 4. It is a catalase-positive bacterium. Catalase is an enzyme that breaks down hydrogen peroxide into water and oxygen, both of which are safe for cells. So this allows Acinetobacter to survive on surfaces for extended periods of time. Number 5. Acinetobacter naturally develops resistance to multiple antibiotics. In nature, it lives in environments where there are other microorganisms, some of which may produce antibiotics to kill off competitors. As a result, Acinetobacter has developed intrinsic resistance to many antibiotics, including aminoglycosides and cephalosporins. Number 6. Acinetobacter forms biofilms. Biofilms are communities of bacteria that live in self-produced extracellular polymeric substances, or EPS. EPS is a complex mixture of polysaccharides, proteins, and nucleic acids. The biofilm matrix protects bacteria from environmental stresses such as desiccation, UV radiation, and antibiotics. It also allows bacteria to communicate with each other through a process called quorum sensing. Number 7. It can survive extremely dry conditions. Acinetobacter can survive in the desiccated state for long periods of time. For example, it has been shown to survive for 1 month on surfaces in a hospital ward. When conditions become favourable again, the bacteria can quickly rehydrate and resume growth. Number 8. It is highly transmissible. It can be transmitted through direct contact with an infected person or surface, or through the air via respiratory droplets. It is also resistant to many disinfectants, which makes it difficult to eliminate from the environment. Number 9. It causes a variety of infections. Acinetobacter infections can range from mild to life-threatening. Some common types of infections caused by Acinetobacter include pneumonia, urinary tract infections, wound infections, bloodstream infections, and meningitis. Number 10. Risk factors for infection. Risk factors for Acinetobacter infection include being in a hospital setting, having a weakened immune system, recent surgery or trauma, prolonged use of antibiotics, and exposure to contaminated water or surfaces. Number 11. Symptoms of infection. Symptoms of Acinetobacter infection vary depending on the type of infection, but may include fever, chills, cough, difficulty breathing, pain, swelling, redness at the site of infection, fatigue, and weakness. Number 12. Diagnosis of infection. Acinetobacter infection is diagnosed by culturing the bacteria from blood, urine, sputum, or wound swabs. It can be difficult to identify Acinetobacter as it grows slowly on standard laboratory media. Number 13. Treatment of infection. Treatment of Acinetobacter infection is challenging due to its natural antibiotic resistance. In general, carbapenems or polymyxins are used to treat Acinetobacter infection. However, resistance to these drugs is increasing. Number 14. Prevention of infection. Hand washing is the most important way to prevent the spread of Acinetobacter. Other preventive measures include avoiding contact with sick individuals, covering wounds or injuries properly, using clean linens and avoiding the use of broad-spectrum antibiotics. Number 15. Mortality rate. The mortality rate of Acinetobacter infection varies depending on the type and severity of the infection. However, overall, Acinetobacter is responsible for approximately 400,000 deaths per year. Number 16. Acinetobacter infections are on the rise. The global burden of Acinetobacter infections is increasing, particularly in low-income countries. This is likely due to a combination of factors, including increased use of antibiotics, poor infection control practices, and a growing population of elderly and immunocompromised individuals. Number 17. It kills mostly in hospitals. Most cases of Acinetobacter infection occur in hospital settings, particularly in intensive care units. This is because patients in these settings are often sickest and most vulnerable to infection. It is estimated that up to 1 in 5 hospital admissions in some countries will result in an Acinetobacter infection. Number 18. It is spread by healthcare workers. Healthcare workers play a major role in the spread of Acinetobacter. This is because they often come into contact with both patients and surfaces in hospitals where Acinetobacter can lurk. It is estimated that up to 1 in 10 healthcare workers in some countries will be carrying Acinetobacter on their hands at any given time. Number 19. It can cause epidemics. Outbreaks of Acinetobacter infection can occur in healthcare facilities, particularly when there is poor infection control. These outbreaks can be difficult to control as Acinetobacter is so transmissible and resistant to many antibiotics. Number 20. Acinetobacter is not the only bacteria that causes wound infections. While Acinetobacter is a common cause of wound infections, it is not the only bacteria that can cause them. Other bacteria that can cause wound infections include Staphylococcus aureus and Pseudomonas aeruginosa. However, Acinetobacter is unique in that it is often resistant to multiple antibiotics, making it more difficult to treat. Thanks for watching. See you next time.